Hello, how are you? Welcome to a new installment of your Pharmacy Assistant. On this occasion, we would talk about what it is used for and how it is used. So let's take a look.
And today we're going to talk about how and when to use glycerin suppositories for temporary constipation. Glycerin suppositories are a good option when we can't poop regularly. They are used when our poop is hard or dry and we have a hard time going to the bathroom. They are very useful when we need quick relief, like after surgery or during pregnancy. And how do they work? Glycerin is like a lubricant, and it also attracts water to the gut, which helps soften the poop. That way, it's easier to poop and we feel better. Now, let's talk about how to use them. It is very important that you follow the instructions on the package or what your doctor has told you. Usually, for adults, 1 suppository a day is recommended. To use it, first wash your hands well. Then, take the suppository out of the wrapper, wet it a little with water so it goes in better, and gently insert it into the rectum. Stay still for a few minutes until you feel like going to the bathroom. Like any medication, glycerin suppositories can have some side effects. For example, they can irritate the rectum, cause diarrhea, or stomach aches. If you notice strong reactions, such as bleeding or intense pain, see your doctor right away. And remember, don't use them for a long time in a row to avoid becoming dependent on them. In short, glycerin suppositories are a quick and safe solution for temporary constipation. Use them as directed and talk to your doctor if you have any questions or problems. Thanks for watching this video. See you next time.
If you've made it this far, let us know in the comments why you're using this medicine.